This week is National Poison Prevention Week, and a new report from the Consumer Product Safety Commission found a 37% increase in child poisoning deaths in 2021. Now, poisoning is the third leading cause of unintentional injury and death among children ages 1 to 19 and can be caused by common household products, things like medication or even your cleaning products. So joining me now is Melanie Wizardo. She is Swedish Medical Center's Injury Prevention Coordinator. Melanie, thank you so much for your time today. You know, some of young kids, sometimes poisonings come from cases of mistaken identity. I'm wondering if you can give me some examples.
Yeah, absolutely. So if you look behind me, I have some examples of that. So what we often see, unfortunately, in our emergency department is that a parent or guardian put a cleaning product in something like a red Solo cup. And then a kiddo came up thinking, hey, this is apple juice, and unfortunately it was like Pine Sol, or the more common one we see is bleach. So we really want to make sure that we're keeping those cleaning products in separate, very identifiable types of containers.
Sure. Well, I mean, you kind of hit the nail on the head there. These are some very common things in our homes. So what are some steps we can take to kind of reduce the risks, not only for kids, but maybe when their friends come over? What can we really do to help protect?
So we want to make sure that we're keeping hazardous items away from food-related items. Actually, only about 3% of poisonings are food-related poisonings. So keeping things up and away and out of sight and reach of children is going to be the best way to prevent those sorts of things. Medications, cleaning products, things like that. And then when we have a lot of times we don't think about other people coming into the house, but that's a huge hazard too. So making sure that guests who come into the house, that if they put their purse or their wallet or whatever that might have something in it, bags, that those are also up and away. So having a hook up high, so it's a little bit harder to get to for kiddos.
Out of reach, right, exactly. Okay, so you kind of hinted there about medication. We have been seeing a lot of cases of poisoning from drugs, both prescribed and illicit. What can we do there? And do you know what's kind of driving that up right now?
Yeah, so I think that most commonly we're seeing just mistaken, totally absolute mistake by parents and guardians. So keeping things separated, making sure they're separate, they're up and away from food items and just not in the way. Most medications will have a bottle that's difficult to open, so keeping it in this bottle that it came in is going to be a good way to keep kids from getting into it.
Absolutely. Now, if this does happen, if a child somehow gets poisoned, what do we do? How do we help?
Yeah, so the very first thing is we want to remove it from the mouth if we see something in the mouth and keep it. Because the first question a poison control person on the phone number is going to ask is, how much was taken? What does it look like? That sort of question. So if they are having any, so we'll call poison control. The phone number is 800-222-1222. And if they're having any visible distress, like difficulty breathing, abnormal behavior, we can go ahead and call 911. What we do not want to do, and a very common thing that we think we should do, is have that person throw up to get the poison out, but that can actually re-injure, cause burns in the esophagus, things like that.
All right, well, we definitely don't want to see that happen. And Melanie, we thank you so much for all of your great advice. And remember, you can watch all of our health interviews right now on CBSColorado.com.